Hey y'all. My name is Clifford Castleberry, and I'm the program manager for the Southern HIV Impact Fund. Today we are on our final summer webinar series titled Immigrant Safety and HIV in the South, Building Trust in a Climate of Fear. We have three great participants and a really great moderator who will all introduce themselves later on, but then I'll go over a run through of Shift. Next slide, please, Sophia. Um, 8 years of community-led HIV impact in the South, SHIFT was created, or the Southern HIV Impact Fund was created as a collaborative response to the disproportionate impact of HIV in the Southern United States, grounded in the belief that local organizations are best positioned to lead change. We invested in groups working across HIV services and the social determinants of health with a strong focus on Black, Latinx, and LGBTQ plus communities. Since 2017, we have supported community-rooted organizations across the South as they advance prevention, care, advocacy, and long-term infrastructure in communities facing deep inequities and persistent barriers to care. Over the last 8 years, we've distributed more than $15.3 million through 274 grants to 105 organizations, expanding services, deepening partnerships, and reinforcing local leadership shaped by trust and lived experience. I'll pass it over to Christopher Cuevas, who's going to moderate our wonderful panel today. Thanks so much.
Thank you so much, Clifford. Good afternoon, everyone. My name is Christopher Cuevas. I use they and them pronouns, and I am a senior program manager here at AIDS United over our Conexiones Positivas Fund. AIDS United, for folks who are new to our work, is an organization who is focused on ending the US HIV epidemic through three strategic approaches: capacity building, grant making, and public policy work. We are so excited to be able to spotlight three incredible partners who are doing just those three things in communities throughout the South. These are groups that have been recipients of funding through the Southern HIV Impact Fund, and are folks who are innovating in the space of HIV care, treatment, and advocacy. Before we jump into introductions and our wonderful conversation with these leaders, I wanted to set the stage a little bit for folks who who may not be as acutely aware of the changing landscape of immigration and how it intersects to healthcare. So if we could go to the next slide, please. Thank you so much. A 2025 Kaiser Family Foundation New York Times survey found that nearly half, 48% of likely undocumented immigrants and 14% of immigrant adults overall report that they or a family member have avoided seeking medical care since January 2025 due to immigration-related concerns. When people in communities are menaced out of seeking medical care, it means they stay sick. It means that sickness stays in communities. Avoiding care because of fear means that an easily treatable condition could blow up and become a dangerous emergency situation that could have otherwise been avoided if circumstances were different. We go to the next slide, please. Medical providers across the country are taking note and speaking out. In February, an op-ed published in the New York Times by three physicians from Philadelphia who have had patients fall gravely ill or die after avoiding preventative care have noted the things that happen to our patients are inevitable consequences of ICE treating people and families as targets rather than human beings, carrying out enforcement without any consideration of medical risk or family circumstances. Detention, deportation, and family separation don't merely cause social and legal harm. They also create profound medical stress that exacerbates chronic disease, worsens mental health, and induces medical crises. Making it dangerous to seek medical attention does not make anyone safer or healthier. When people are deterred from preventative care, treatable conditions worsen, emergency department utilization increases, and costs rise for everyone. Next slide, please. A California physician elaborated on the strain this is causing the American healthcare system in an op-ed published in the San Francisco Chronicle. Over the past year, the Trump administration's immigration crackdown has spilled into emergency departments and hospitals across the country. And with the federal government's 2025 decision to allow immigration agents into sensitive locations like medical facilities and schools, hospitals have become front lines of heated battle. 32 people died in immigration and custom enforcement custody in 2025, the highest recorded number of deaths in more than 2 decades, and most died in hospitals near detention centers. That death toll in 2026 has already outpaced last year's numbers. Detainees are often held in overcrowded conditions with inadequate food, little to no health services, and without their necessary medications. Hospitals and healthcare institutions must do more to protect all of our patients and the providers who take care of them. The integrity of our emergency departments and the entire medical safety net is at stake. We can go to our final slide, please. Now, according to the investigative reporters at Uncloseted Media, heightened immigration enforcement and stricter U.S. border policies have caused disruptions in HIV care, testing, and prevention for the communities most vulnerable to the epidemic. Immigration crackdowns and raids in cities like Minneapolis have driven undocumented and Latina patients away from healthcare clinics. These incidents don't exist in a vacuum. According to a survey released in April by the American Academy of HIV Medicine, harmful federal policies and funding decisions disrupting HIV care in clinics nationwide. HIV providers from across 47 states who participated in this survey noted that 86% of the populations that they are seeing are falling out of care. This includes transgender people, migrants, undocumented individuals, and people experiencing homelessness, who are the folks who make up the bulk of the communities most vulnerable to the HIV epidemic. Of those same providers who saw declining attendance among undocumented patients, 83% of those physicians cited that the reason that they're seeing a drop off is because those patients are afraid of immigration enforcement. One such patient who actually delayed cancer care eventually died due to foregoing care because of that same fear. And as reported by respondents who heard from patients about specific barriers to remaining engaged in care, 61% of those patients cited losses of insurance coverage, such as the Affordable Care Act, as major concerns, or the challenges to Medicaid enrollment, prohibiting them from being able to continue with their care. Now, affordability and immigration enforcement are two of the biggest hurdles that our communities are having to navigate in this moment. As we continue to face a wave of legislative attacks and a changing rhetoric that is demonizing immigrants and mixed status communities across this country. And in our effort to challenge this misinformation and to promote positive messaging and really to reframe the conversation, we would love to bring in our three guest speakers, Tania Jimenez, Judith Montenegro, and Elias Diaz. I'll give them each space and opportunity to introduce themselves, and then we'll jump into our discussion. And for our guests joining us today, I invite you, please prompt any questions that you have for our panelists in the chat. Use the Q&A feature, and we'll be sure to answer those questions along with the questions that we've prepared for our panelists. So, Judith, if we can start off with you, if you wouldn't mind introducing yourself.
Hi, everyone. I'm Judith Montenegro. I'm with the Latinos in the South program. I'm the director, and I'm with the Latino Commission on AIDS. And my pronouns are she, her.
Thank you so much, Judith. Tania, if you could go next.
Sure. Well, thank you for the invitation. My name is Tania Jimenez, pronouns she and her, and I represent Asheville Latinx Services here in North Carolina.
Thank you so much, Tania. And Elias, can you round us off?
My name is Elias Diaz, and I'm based out of Eagle Pass, Texas, where I serve as Executive Director of Eagle Pass Safe and City Councilman for the City of Eagle Pass.
Wonderful. Thank you all so much. Now, before we dive into the heart of our discussion today, I would be remiss if I didn't acknowledge that each of us, from the different places that we come from and the different types of advocacy work that we engage in don't do this work alone. In our movement, we never show up to this work alone. We carry our communities, our histories, and our loved ones with us. So I'm wondering if each of you could perhaps take a moment and just share with our audience who or what communities are you carrying into this space with you today? And if we could go in the same order that we did our introductions, that would be great. So Judith, if we could start with you.
Yeah, in this space, I'm carrying all of the migrants. I'm an immigrant, and especially those who can't travel right now, who have restrictions on being able to move and explore and enjoy. So yeah.
And I'm carrying all my transgender women's transgender sisters that they're being deported right now. That they've been having a hard situations. And I think myself as well, and and my family. But I would say more like my trans sister that we're having a hard time right now.
In this space, I carry my gay brothers. It's a part of my identity that has been shaped by the AIDS epidemic, influencing the way that we can love ourselves and love one another. I'm also carrying the people of Southwest Texas. It's an area that was once Mexico, and a lot of our communities are either Mexican Americans or recent immigrants, but really the border crossed us in this part of the region. And I'm carrying their stories, right? And their stories of loss. I'm also carrying my indigenous ancestry, the Coahuiltecos that lived in this area before. It was probably one of the first tribes to be eradicated by the Spanish. And the way that that happened is the Coahuiltecos were very prone to assimilation. And so they just integrated into Spanish ancestry. And with that said, I also carry the struggle and the power struggle of also my Spanish ancestors who have caused a lot of harm and damage in my community, but continue to be a part of who I am. And so I carry that identity struggle with me on a daily basis. And I also carry the one recent story, right? My abuelo Chuy, who crossed the Rio Grande wearing nothing but a backpack. And so I carry that story, and I think often about his immigration story and how it shaped my own story of being able to grow up in this area and eventually become an elected official, and the power struggle that I go through on a daily basis with the state and federal governments and their view of immigration and how it differs from mine.
Thank you all so much for grounding us in the people that we're bringing into this space, our beloved, our loved ones, the different parts that make us who we are, and the reason that we engage in the work that we do. So I'm incredibly humbled to be sitting here across the virtual room with you all. So thank you. To start us off in our conversation, I noted earlier that affordability is a challenge that it directly impacts healthcare. And it is quite alarming that we are seeing a huge divestment in the public health system by the federal government. With pervasive challenges to patient access to care, like cost containment measures related to AIDS drug assistance programs, as we recently saw in Florida, with efforts to radically shift that program and to fund efforts or mandated reporting requirements of protected patient information, as we're seeing in some southern states requiring information sharing with the Department of Homeland Security. How can providers and non-clinical community-based organizations proactively protect access to care for undocumented and mixed status families before we reach these resource cliffs, before we start to have to make really difficult decisions about whether we can continue to provide this work or engage in this advocacy. And this question is for the entire panel, so anyone feel free to jump in.
I'll go first. So in terms of, for example, as you mentioned, ADAP is one example. We did have some brief periods where we saw a little bit of a glimpse as to what was going on in Florida and what it looked like in real time, right? And I think a lot of the states along the South have been able to see to varying capacities what that might look like. Um, I think it's important for administrations at the organizational level to start thinking about what can we do to mitigate that, right? I think getting creative with our funding sources. Unfortunately, we've seen a big divide, right, with a lot of the programming that's going on with HIV and all of the HIV cuts. But there are still some resources that we can continue to leverage to continue, like using, for example, 340B pharmacy revenue to kind of mitigate some of those costs. Also, I think at the provider level, it's really important for us to think. I was having this conversation earlier, right? That a lot of this anti-immigrant sentiment is not precisely new. It's definitely intensified, right? But we've seen it, at least I've seen it in border communities for a pretty long time. It used to be that as a provider, right, like for especially for people that were going through their status change, right, or had been recently married or were new to the US, a lot of people have not been wanting to access care or access any type of public resource, thinking that it might affect, for example, their immigration status. And it used to be as a provider that we could have a sensible conversation with people about what their options were and how they could navigate care. I think one of the biggest things that we can do for our clients is to acknowledge that we are living in unprecedented times. That fear, it's grounded in reality, right? And for us on the front lines that get to see clients on a daily basis, I think we need to acknowledge that for ourselves and for what we can do as providers, but also acknowledge the fact that this is a real reality, right? I've done both on the access to care general side and access to care with behavioral health. We've gone above and beyond to leverage. I've created funding opportunities that are coming from the city to be able to fund free access for mental health care services for everyone. We've expanded our telehealth delivery services. We've also started getting into a relationship-based SMS type model where we can provide case management through text messaging services. And so all of those measures, they're not, I can definitely not say that they're neither an immediate solution or a be-all end-all solution to the types of problems that we're navigating. But I think that in the cases that we've been seeing at this level, they've helped us to mitigate impact. And I think that, when we work collectively and we put our heads together and think about what is it that we can do, I think taking steps in the right direction is something that we can do with each other and with our clients, and just acknowledge, right, that these are unprecedented times. I don't know what's going to happen tomorrow, unfortunately, or next year, right? And so just having that internal conversation with ourselves is one of the best things we can do for our clients.
Thank you so much for that. Judith, I saw you also come off mute. Did you want to add some additional points?
Yeah, I can add that it's important for organizations, providers to really understand what those changes are and identify any contradictions, right? If there's a contradiction between state and federal law, we need to be able to understand what those contradictions are and how we can navigate them to best protect patients. For some of our southern states, federal laws often worked as guardrails for against some of the state policies that we would see. And those guardrails still exist in many cases. And it's being able to identify, although we have seen federal changes, right, under HR 1, we have to be really mindful of that. I think also what I'm going to share now, I'm not an attorney, so this is not legal advice. This is organizing advice. And that is that a if you can delay any compliance with some of these bills and laws being passed impacting public benefits, um, try to do that. There's also something called malicious compliance, where you flood systems to make sure that they don't work the way the way that they want them to. Like if they're asking you to report folks, report everybody, right? Report as many people as possible, so that you're clogging up systems, right? I think it's also important to get any information in writing with clear instructions. For example, in North Carolina, there was, as part of the Medicaid negotiation for rebase, in the budget, they included now that the Department of Health had to report to the Department of Homeland Security if any applicants were ineligible due to legal status. And we know that Medicaid is the largest payer of HIV care. And so we also know that because of this, people are not going to be able to receive the services that they need. However, the law doesn't state how to report. Like, there's not a phone number for like DHS. Like, who am I calling? Am I calling, a helpline at DHS? I don't know. There's no instructions. And so it's important to ensure that the health department is not out seeking these instructions. And this requires some conversations with the health department. It also means that we hold our legislators accountable for the laws and bills that they pass. We know that these bills are being passed right now, because there's a fervor about it to pass them and to pass them across the South. We also know that for example, for us, it's also that providers need to plan a rapid response, and we can do that in partnership with providers when these things happen. So, for example, in the North Carolina, we know that 27,000 children and pregnant people are going to lose coverage, along with almost 250,000 or more North Carolinians. They're going to lose Medicaid coverage. Well, we know that they're going to get letters between June and July, and October 1st is the last day. So that means we need to make sure that if any folks are impacted that we know in our communities, it's to make sure to get extra medications, right? Make sure you have 60 to 90 days, especially if you have a chronic health condition. Make sure that they're really not eligible, right? Like, people may get letters thinking that they're not eligible, but there may be some mistake. So making sure we're in community talking about folks understanding if they're really not eligible. We need to encourage FQHCs to prepare for some of this influx of folks having to seek care, because FQHCs, federally qualified health centers, are the cornerstone of care for a lot of folks who are undocumented or uninsured. And we need to make sure that providers are prepared to add additional appointments before and after this transition, because folks are going to need to seek care. We also have to prepare case managers, right, to make sure that they're helping with re-enrollment, and that it's happening regularly, and making sure that our communities know that they cannot miss deadlines when it comes to re-enrollment in some of these benefits, right? Whether it's ADAP, HMAP, Medicaid, they're looking for ways to roll people off, and we need to make sure that that we mitigate, as Elias was saying, as the coverage for as many people as possible. And in the long term, we really need to do some advocacy as HIV orgs, urging Congress to stop funding ICE, They have now 8 times their budget, and really monitor what this happens in communities, especially like rural hospital closures. These are all conversations that impact the care that some of our communities receive, and impact also the care of other folks in communities, right? Like if we're not healthy, it also means that other folks are not going to be healthy either.
Thank you so much. You've both touched on something I think that is a really interesting point to raise, which is I think I come from an abolitionist background, so like any part of the state is an op for me, whether it's the health department or the police department, you name it. Um, but sometimes movement work necessitates that we need to work with some unlikely allies. And sometimes that needs to happen behind the scenes. Sometimes it needs to happen, I think, covertly. Um, there's a political science theory by this theorist, James Scott, who refers to this as what he calls infrapolitics, camouflaging resistance during times of defiance, right? We are living in a place we're living in a time where any public opposition from someone who is a political public servant will be met with direct repercussions, not just from the electorate, but from their own party. And if you happen to be a part of the party of the ruling class right now, and you have objections, expect to be primaried, expect to be taken out, expect to be replaced by someone who is going to be very subservient. Um, and so admittedly is tough for some of those unlikely allies to step up and be vocal. But I've seen it be successful when we work long term, when we build these relationships and we try to find common ground. And something that I know you and I, Judith, have had really long conversations about offline is that exact act of solidarity. How do we practice this tactical solidarity with folks who we may have some values misalignment with, or who we just need to like bring along a little bit more, help them unlearn some stuff, or what does that ultimately look like? I'm wondering if you can share a little bit more.
I want to add something to what Judith and Elias was saying, but we need to be we need to protect, or we need to educate us as a leader, and then the providers. How can we protect also the information of our immigrant community? Because sometimes a lot of immigrant community, they're scared now to get their medications because they're scared the information that's gonna go with I. So I think that's also I think we need to, as a leader, we need to start telling or have more conversation with the community, not to be scared and try to get their appointments and try to get their medication. Because a lot of people now, they're just being scared even to make an appointment. So I think that's also that I just want to add that point to the conversation.
Yeah, I appreciate you lifting that up, Tanya. That links back to something that was said was, if there is no guidance, there is no reason to be afraid because there shouldn't be any action if folks start to seek services or care. But until that happens, it's a need to just be in constant communication with community. I appreciate you lifting that up.
And I think that that feeds really well into this question, because it does require a some we do need allies at all levels, right? We do need to identify individuals. In Florida, when the AIDS drug assistance program was under threat, and we were hearing all of these things, the whistleblower was someone who worked for the health department, who shared with organizers, hey, this is coming, right? And so it didn't give us a lot of time, but it gave folks in Florida enough time to know to start organizing that this was a real threat happening. And so it takes a lot of, and I'll say maturity to 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 share some of the space with some of the folks that may not always show up for our communities the way that they should. Um, but we have to remember a couple of things. The first one is that the health department is a government institution, right? And it's not community, it's not a CBO. So the accountability and transparency needs to look different. With, they are under different rules and laws, and we need to remember that, right? We always need to keep that in the back of our head. The conversations that we have with government institutions at this moment are closely being monitored. And so we don't want to compromise also the health department, um, because we want to protect the folks that are working there, um, especially during FOIA requests, communications that we have with them. Some states are also threatening legislative or criminalization to public servants who hinder or refuse to work with the Department of Homeland Security, right? So this data protection also means protecting them, right, from the conversations that we're having. And so we need to be really careful about what we put in writing, including in requests, in emails. I'm a big fan of in-person meetings, right? Let's go meet at a coffee shop. Um, because through these relationships, I've gotten screenshots, I've gotten photos, I've gotten printouts, I've gotten signal messages, right? Like I'm protecting them, and I know where some folks that we've developed allyship with, what allyship can look like, right? And it doesn't mean that um, I'm not critical of the way the health department will function and do things, or applaud some of the work that they are required to do, because that's an institution. But I can invest in individuals and make sure that they show up the way we need them to. And I think it's also important to note that HIV organizers, HIV providers have had different relationships with the health departments for a long time, right? But that also means that in this moment, immigrant right groups have not had those relationships, right? And when we're seeing these impacts to public benefits, to care, to access to care, to Medicaid, we have a responsibility also, as folks that are closer in these relationships, to be allies to immigrant right groups, to folks, to LGBTQ groups who do need some information from health departments, who do need health departments to hear from them to bridge some of that. And so I think there's a way to deepen those relationships, and there's a way to use some organizing to ensure that we're getting all the information we need without having to go through, say, the legal team at the health department. We're not going to get anything through them, right? It's through the individuals that work their day to day, who can, give us a quick shout if something's coming down the line.
I appreciate you lifting that up. And I think that's really true, is finding those co-conspirators in these institutions who are willing to maybe go against the institution because they just don't agree with what's being done. They don't agree with the communities that are being persecuted, but they still have bills to pay. They still care about, trying to make the world a better place through the work that they do. So finding ways to lean into that, and open up those relationships to other folks to take advantage of, for when the emergency comes and we need to raise the red flags. So I appreciate you lifting that up. Shifting gears a little bit, we've talked about strategy in keeping our communities safe. Now I want to talk about like application. Um, the psychological tax on immigrant communities brought on by increased enforcement, coupled with extreme isolation, is causing an untenable mental health crisis. We have incredible folks on this call who are implementing practices in their advocacy and in their direct services, who are working to disrupt that and create a community of care and of visibility. So I'm wondering, what clinical or non-clinical methods are your organizations applying to be able to support the mental health and well-being of your clients, of your patients, of folks who you're in community with during these really challenging times?
I could go first. um, well, this is what we're doing in Asheville Latinx. Like you said, we're having a hard time. We're having a hard time. I having a hard time. I had to go to detention center and visit transgender women, and it's really hard to see them and hear what they're saying, and not getting their medications or not being treated well, and it's just not they're not just it's not just their mental health, but it's also our mental health, our leaders mental health too, not just not they're not suffering themselves, we all suffering together. So what we're doing in Asheville Latinx, we're doing Temascal, we're doing ancestral therapy. So we've been doing Temascal, LGBT Temascal. We've been doing that. We've been doing a cacao ceremony. So we've been doing all that. We've been doing cookout just to have fun, just to talk, just to hang out. So we've been having the quinceañera. We had an LGBT event. We're gonna have a go in Asheville Latinx, and we brought those Roblox, the dance and everything, and just try to forget a little bit of what we're hearing in the news, what everything going on in the world, not just with HIV, but everything that is going on. That is a lot. So I think by having this moment, by just having a cup of coffee, a bread, I think, we forget a little bit of what we're going through. Plus, we're working with El Futuro, which is also a mental health organization, also Spanish Federation, who has La Línea de Salud. And we've been referring people to La Línea de Salud. We've been referring people to El Futuro. They've been taking therapy with El Futuro as well. So we've been doing like the clinical side, but we've been doing also the fun side. So we've been doing both of them. So that's what we're doing in Asheville Latinx. So right now we're trying to do in another retreat, in a small retreat for Temascal. It's gonna be a whole day, and we wanted to have a carne asada as well at the end of the Temascal. So we try to bring all that because we need to have fun as well. We need to join life. We need have we need to forget about what everything going on in life, and like I said, not just for, I mean, this is just happening for everybody. This is impacting everybody, and this is everywhere. Every conference that I go, I heard the same thing. What everything was going on. We're scared. We're scared. I'm scared. Scared to travel. I'm scared to go to conference, but I need to be there. I'm scared to go to the detention center because I'm scared one day I'm gonna be. They're not gonna let me go out. But I need to go see my friends. I need to go see my sister. So that's what we're doing in Asheville Latinx, to take care of yourself and to take care of myself as well. Just trying to have a little bit of fun, just to have a not exactly have food and have to have a workshop. We don't have to have a workshop being able to have a plate of food. You know what I mean? We could just have a plate of food without the workshop. We're tired, too much stuff that's going on that I think we need to have fun too. We just need to forget about what's going on outside. So that's what we're doing in Asheville Latinx.
Thank you so much, Tanya.
One thing that we've been doing is, so it's important to contextualize that a lot of what we're seeing, the same administration that is, fostering this anti-immigrant sentiment is also fostering anti-LGBTQ sentiment. There there's movement against like food security, right? Like all of these different issues that are impacting in a lot of ways the same community, right? Or different facets of the same community. One thing, historically, Able Passive has been dedicated to LGBTQ services. And so one thing that we've been doing to address the intersection of these multi levels of oppression have been to really lean into. This year, we saw a huge wave of anti-LGBTQ bills. A lot of them affected the way that we were already doing programming, right? So one of the most significant has been SB 29, which prevents us from being able to have basically pride events in public spaces, or having performers in public spaces, right? And so one of the things that we've been doing is to really lean into that underground aspect. And so we started having more, for example, house parties. We have decided to scale back on the publicity of our Pride event for this year. But we're going underground with it, right? The theme for this year is El Baile de los 41, which kind of leans into that whole concept of, having these, taboo secret parties, but still fostering a way to have that connection. A lot of our focus groups are also done not in a clinical setting. Now we're moving into home spaces and private spaces where people feel more comfortable. We're doing them after hours. We're doing different things where people are able to kind of participate more freely and just not feel like it's a place where they're going to be targeted. I think sharing space and sharing community and finding ways to do that in creative ways has been, elemental for this. We've also seen a huge cut in funding, right? So we're having to do all of these things with less staff, with less money for programming, right? So we're really leaning into digital content, trying to keep people connected through digital spaces, whether that's through videos, fostering more emotional connection. We have seen a big increase in our social media following. And so we are tracking our numbers to make sure that it's working, but like we are staying more connected just in a different way, in a way that seems feasible to us right now. But that is something that we're doing. We're also expanding some of our services into non-traditional places like bars. We don't have safe or LGBTQ spaces, but we are training staff at different bars, different smoke shops, different places to be able to be more welcoming and receptive to the people that we serve. And so finding, as you said, like allies, sometimes um, non-traditional allies, right, in this space, but trying to make sure that we form spaces of community and think about people, not as clients or patients, right? Really think about their whole needs, everything that they're going through, and seeing how we can meet some of those needs outside of the clinic.
Thank you so much, Elias. Tanya, you shared something really powerful earlier, which is sometimes we need to take a break from the programming and we just need to focus on like the joy that we can cultivate because that's what will keep people coming back. That's what will make sure, when so and so needs a connection to a doctor because they lost access to care, or when they need to find out where they can go to get an HIV test. And they say, hey, I remember I met Tanya at this event. She was so kind and she opened the doors and I felt like I belonged. That person will message you on WhatsApp and say, hey, I have a question. Can you help me? Like, I think that is one of the most powerful lessons that advocates, that clinical providers, non-clinical providers, folks across the space can learn is sometimes we just need to invest in the creation of space with and put the like the deliverable, like, whatever that is, like on the side and just focus on like the person, the connection.
And that's how we build trust. That's how we build community. Because that's what we need right now. We need community. We need to trust in each other. We need to count on each other, and that's the way we could do it. That way people they don't come because, we need so many people because we need to make a report. No, we wanted because we wanted to have a community. We wanted to have joy. We wanted to have fun. We just wanted to join, and that's what we need right now. We have too much going on in life with work, with personal stuff, with everything that is going on. That we just need sometimes just our times to just to be with the community, just to enjoy life, just to have fun, just to dance or have a drink, a Smirna, one or two. Why not? We deserve it. We need it. We need a break. So we're having a hard time. I need a break. I'm not having a hard time.
Hear that. On that thread, I've seen some of the work that you all have been doing through Ashboro Latinx Services, not just with folks who um, are LGBTQ plus, folks who are living with HIV, but I've also seen you navigate um, uh, the spaces and the communities that they're a part of, their family networks, their faith networks, helping folks unlearn things like HIV stigma or homophobia or transphobia. in order to create greater acceptance, love, and affirmation for people living with HIV, for LGBTQ plus folks. Wondering if you could talk a little bit more about like how do you challenge those misconceptions and how do you help folks, yeah, just like open up their hearts and their minds a little bit more?
It's interesting, and I love, we don't just work with the LGBT. Like, of course, that's my main focus, LGBT, especially transgender women. But we work with the Latinx community in general. We do community baby showers. We do Tercera Juventud that we do once a month. Now we're doing salsas classes, and then we had yoga. We had yoga and meditation. We had Zumba. We have done so many stuff to build the community that we have built. We give out toys in Christmas. We have our posada. We have our backpacks giveaway in July before they go to school. So we try to build that. We have that community. We've been doing a, where we close the street to do oh my god, I forgot um oh my God, my mind just went off. El desfile, the parade. We do el Dia de los Muertos parade. We do Pride. So we do it, and it's so fun, Crystal. To see old ladies, like 75-year-old ladies, 65 men with us marching on Pride. They're not LGBT, but they're supporting us, their allies. So it feels so great. Like, damn, we've been doing an amazing job. We're in a rural area, so but we're like, Latinx is really strong in Asheville and surrounding areas, and we were working so alone, and they respect us, they love us, they're always there. Like, it just feels good that we have built that community and that we're like reducing the stigma and transphobia, homophobia, but we still need to work a lot on HIV stigma. That's still high in the Latinx community. That's the only thing that I think that we still need to work on it, that is really hard to decrease it, especially with us with Latinx. And I hear every day with the community, when they talk about HIV, they get so scared about HIV. With I always tell them, we try to educate, HIV is not a crime. HIV is not a crime. HIV is just like having diabetes. It's just to have any other something that there is out there. So it's not a crime, and we try to reduce that. But that's the only thing that I think is we still have a little bit of a hard time. But other than that, with the transphobia, homophobia in Asheville with our community, it's been amazing. They love it with us. When we have events, they invite us to the baby showers. They invite us to do. They want to do the drag show. They would say, "Hey, we need 3 or 4 girls to do the drag show." They want us, the LGBT group support. They're volunteers when we do the Tercera Juventud. We're the one who serve the food. We're the one who put the place on the table. And we love that. I mean, we have built a community in the rural area. So I think if you guys go to our Facebook page and you see everything what we do, you guys will be amazed how we're building community. And I'm also really grateful with that you guys, with other organizations that be supporting our work, supporting grassroots organizations that we're doing the work. And I'm really grateful for that, because without your support, we would have been doing the work that we're doing. So thank you so much for the support that you guys giving us. And we're really glad. And anytime, and I always tell you, and every time you guys wanted to come and join us, that we have a lot of events, you guys are more than welcome to come. And doors are always open for everybody. So, and that's what we're doing in Asheville. And I feel really proud of the work that we'll be doing, because it's just not me, it's everybody. It's everybody, because it's just not me. Everybody, we've been doing this work. So I'm grateful for the family that we have.
Yeah, I appreciate you lifting that up. And I think the lesson that I'm taking from this is like leaning into a lot of cultural organizing and programming. Like that is the direct thread to like disrupting some of these preconceptions or these notions that folks have, is when we're there, when we lean in, when we celebrate the many facets of ourselves. On that train of thought, some things that you've shared with us, Elias, talk about really challenging um, these cultural stigmas or these anti-immigrant biases, and you're disrupting that by creating some of these braver, safer spaces for folks to exist as themselves fully and authentically, um, in spaces that feel in spaces where folks already are, where they feel like they can sort of let their hair down a little bit. You're like, no, give me the whole chongo, like let your hair down all the way. Um, So what other strategies have you seen really to support folks in confronting those internal biases or helping to unlearn prejudice? Yeah, so that they can start to live in their truths or support other folks in that.
Yeah, I think the overall strategy, and I've been working on this strategy long before this administration, right, is to help people find their humanity. And by finding their own humanity, I think it opens doors to really see other people for who they are. We do a variety of different things. So before SB 29, our part events were hosted in a public space, in a public park. They were family oriented. It was old people, it was young people, it was non-LGBT people with LGBT, like it was always centered around that, like building community and humanity, sharing people's stories of, this is a really small town, and so a lot of LGBT people would leave. And so getting the grandmothers and the mothers, I got my mom and my grandma involved in a campaign to talk against LGBTQ stigma, right? And how LGBTQ stigma was affecting mothers and grandmothers in this community. Because when we shun one of our own and we disintegrate a family, the person that is of LGBTQ plus experience is not the only one affected. Their mother's affected, their father's affected, families disintegrate, the community loses out on talent because we're some pretty cool people, right? And so when we don't live here, we miss out, right? We miss out on that bravery and that talent and that courage and that authenticity. And so finding ways to communicate that to community. We also started to display, we did community-wide training, and we display a safe space sticker and we've developed a safe space directory when people, had been asking us, where can I go cut my hair? Where can I go to the bank? Where can I shop without feeling like, like now a lot of people feel like actually afraid for their lives, right? Like if I go cut my hair, is that going to mean that I'm going to get beat up in the parking lot, right? Or does that mean that I have to fear for my life? And so making those community contractual agreements with people in this community that like, hey, this is your cousin, or this is a friend of your cousins, or like you finding ways to find community. We also expanded our mission. So we pivoted from being exclusively LGBTQ focused, and we started really getting into, we started first with harm reduction, right? And started building community within harm reduction community, started doing naloxone training and communicating our successes on lives that had been saved. We started building allyship within those spaces that already needed that voice, right? And felt like they had nobody to speak up for them. So we started building allyship with other community members, first the substance use community, but also other community members. We've gotten also involved in advocacy work for immigration, people who felt like they did not have a voice, right? And trying to do that collective effort to make sure that we were coming together and we were sharing that space and amplifying each other's voices. We got into domestic violence, and really one of our biggest initiatives recently has been the work that we're doing around domestic violence. We started a donation center where people can drop off and people can pick up. And the person that leads that project is a woman of trans experience. And I often talk about, when you need a shirt on your back or when you need baby formula to feed your child, you don't care if you're picking it up from a trans woman or a cisgender woman or a fat woman or a skinny woman, like you just want whatever it is that you need. And so we reminded, I don't know if we can replicate this nationwide, but we were able to successfully do it in Eagle Pass. And we said, you need to remember who you are, and you need to remember that these are your neighbors, your friends, people that you love. People that you love are being affected by this on a daily basis. And it started to work, right? It started to help us to build onto programming. When we lost funding for a lot of our LGBTQ programming, we started to figure out, like, what are other ways that we can pivot? What are ways that we can serve more people, different populations, still carrying true to that mission of making sure that LGBTQ people feel respected and feel like they have a place of dignity. But now we just have a different strategy. we're serving other people, using our LGBTQ people to serve other people, and that is bringing stigma reduction to this community.
Thank you so much. I agree with something you shared earlier. LGBTQ people, I think we're pretty cool people and we're changing the world. And we can include our allies in that. Those folks who are really willing to throw down, folks like Judith, and others. So, with the last few minutes that we have, we are in the heart of election season. It is anywhere and everywhere you go in this country, there's an election happening, or one that is just about to happen, or one that has just happened. But we are gearing up for the midterms, a really important one. Will no doubt witness a further wave of attacks that dehumanize immigrants or scapegoat our communities for the many social or political ills that are not our fault. Things like affordability, wage theft, the energy crisis, like whatever they can scapegoat immigrants, LGBTQ plus folks, people living with HIV, they will do, because it's easier than actually confronting the challenge. I'm wondering if you have any final words or thoughts for folks in community, or perhaps folks who are running for office, that maybe can challenge misinformation or perhaps restore more empathy or compassion into the broader discourse. And this is a question for the entire panel.
I'll say two things. And the first one is that I don't know that we'll be able to undo a lot of the harm and mentality that a lot of folks have. I think that's going to take a long time. But I will say that there are opportunities that do require some cross-movement work, which includes, like, we've seen this push against data centers in rural communities. And I think, being like, we don't want a data center and we don't want a detention center. We don't want these things impacting our communities in this way. I think there's ways to hold elected officials accountable to change some of the narratives around what communities can look like, especially in rural areas. But I'm actually also not going to answer your question because I'm going to say something else. Often through these elections, we think that in the midterms, we're going to return back to a place of how things were run before. And that is, for me, not a goal. My goal is not to return back to how things were being run before. My goal is to return back or turn things back to take this as an opportunity to make things better for our communities, to create some stronger guardrails to protect our communities. And I think we've seen what is possible in a very short amount of time. In 2 years, we've seen how quickly they're able to dismantle things. And I think it's important to note that elected officials, we've seen the example, and so now we know what you can do. Yeah.
Yeah, thank you for that.
Thank you so much for sharing that, Judith. I want to echo a little bit of what she said. One, I think you kind of touched on the aspect of public narrative and public discourse, right? And how we can lean into community organizers to really have a narrative shift, whether it's at the local or state or federal level. I do think that there's a way that for those people that are running for office to really lean into, politics and organizing are related, but they're two completely separate functions, right? And I can tell you as a former I'm still a current organizer, but in my current role as an elected official, it looks a little bit different, right? My responsibility is to represent my constituents. And so leaning into those organizing groups that will carry a lot of the weight of the narrative change and positioning yourself as an elected official to be the voice of the people, right? I have been in a situation before where the voice of the people did not reflect my own, right? And so I think that with a lot of these changes happening, being able to work hand in hand with organizers that say, recently the state government came and put some additional boys in our park, took possession of our park. It's something that's happened before, but this time we have a community organizing group that is vocal and that is willing to do a lot of that narrative change on the ground. And I'm joining forces with them, right? Because now there's voices in the room that are saying like, this is not okay. And now I get to say, I show up as an elected official, I'm just representing my people, right? And so there's ways to do that. There's ways to stay engaged in discourse. You mentioned community members and people running for office. For the community members, I say there's no other way. You have to run for something. You have to get in there, you have to get dirty, you have to roll up your sleeves, and this is not going to change. This is, as Judith mentioned, we see a glimpse of what's going on with Project 2025. Eventually, there will be other projects, right? And other forms of action that if we don't set up these guardrails now, if we don't make these advances, I never thought to see possible, especially on my end as an elected official. I always feel like stuff moves so slow in government. Government has moved incredibly fast to dismantle work that we've been doing for decades. This is not going to change, right? Like even if we have, if the outcome of the midterm elections is favorable to us, it's going to take time to undo all of the damage that has been done in these past 3 or 4 years and the ramification of what it might look like for the people that have already been put in these positions, people in legislative positions, in justice positions that are going to continue to impact us for a really long time. And so I think the antidote to that is we have to get in there. We have to fight. And we have to think about different ways that we can fight. I personally myself, I've realized that I'm coming to the end of my political career and I really want to go back to organizing. I really want to go back to holding elected officials accountable. And I feel like that's my lane, but it has to be somebody else's lane to actually be in the seat, right? And to steer the boat in a different direction. And so I think it's going to take all of us. But the fact that we have to fight, there's no way around it. You have to fight, you have to get in there, you have to organize, and you have to work with other people that are doing similar types of work to be able to get this done.
Thank you. Thank you.
And I would just add, we need more LGBT leaders running for these political positions. So we need more leaders out there. So not to be scared and just go for it. Just go for it because we need it. Nobody can understand what we're going through. Nobody can understand what we need. Only our community, our LGBT community. So I will definitely encourage of leaders LGBT out there, not just go out and run for these positions. We need our communities. We need our LGBT leaders in these political positions. So not to be scared and just go for it.
Well, thank you all so much for such a really thoughtful and thorough conversation. I just have a deep appreciation for everything that you all are doing, how you are improving the conditions of our world, and in the ways that you are, in the communities that you touch. It's been a thrill to sit across the room with you, and chat for this last hour. Um, so I hope that our attendees found this conversation as stimulating as I did. Um, we invite you to follow our partners through their social media channels, and to stay in touch with us here at AIDS United. We'll be posting this conversation. It's currently being live streamed through YouTube, but we'll also be posting it across our social media channels. So we invite you to share. We invite you to stay engaged online, and to stay connected with our partners and all of our future activities. So with that, thank you so much for this last hour. I hope everyone has a wonderful rest of your